All right, so we're looking at another set of drugs, which is known as aromatase inhibitors. So for these aromatase inhibitors, you want to just look at what their applications in obstetrics. All right, what are they used for, and all of that. Okay, so for aromatase inhibitors, they are just drugs that basically what inhibit, right? Inhibitors, of course, they should be blocking something, So is that something we are trying to now establish what it is, So for example of those drugs, we have drugs like Letrozole, we have Anastrozole, and Exemestane. So they are primarily used in gynecology and oncology, but their role in obstetrics is quite limited and generally not recommended during pregnancy. So basically it's gynecology and oncology. Sorry, I'll actually rearrange this. Okay, so what does these aromatase inhibitors do, right? All right, so it blocks aromatase enzyme. So the enzyme does not convert androgen into estrogen, right? So it lowers the estrogen levels in the body, used to treat estrogen dependent cancers, like you have breast cancer, you have endometriosis, uterine fibroids. Those ones, they depend on let estrogen levels be high, so it's not to be used in pregnancy. All right, so estrogen is needed for fetal development. So if you use aromatase inhibitors, they can cause one or two issues, right? Blocking estrogen can lead to miscarriage, birth defect, or fetal growth restriction. All right, so reproductive medicine application. While not used in pregnancy, it can be used to induce ovulation in women, particularly women that have polycystic ovarian syndrome, control the ovarian hyperstimulation for assisted reproductive technology, may be preferred over clomiphene citrate. So conditions treated outside pregnancy is they are used for things like endometriosis, alright, leiomyomas, estrogen dependent cancers. Alright, so that's all we have for aromatase inhibitors. That's in gynecology and oncology.